Hello, my name is Kambiz Bazari. Aseptic loosening and the malpositioning of implants. These are two of the biggest problems associated with total hip arthroplasty. Both problems persist despite major technological advancements in robotics and navigation. Some academic publications claim that the incidence of these complications have actually increased over the last 10 years. This may mean that we're missing something. Generally, aseptic loosening is blamed on the implant, while malpositioning is blamed on the surgeon. But I believe our surgical installation technique can cause both malpositioning and aseptic loosening. That is because these problems are intertwined. Both are caused in part by the surgeon's non-standardized installation technique, and both problems can be solved by standardizing the force used to install implants into bone. Tremendous amounts of force are used to perform a total hip arthroplasty. Surgeons routinely use upwards of 10 kilonewtons of force to impact implants into place. The mallet gives the surgeon no ability to control, modulate, or even monitor the force that they apply. The inability to regulate force is especially destructive because force is a vector quantity with components of magnitude and direction. When the magnitude of force is unregulated, the surgeon can either over-impact or under-impact the implants into the cavity, both of which can cause aseptic loosening. When the direction of force is unregulated, the surgeon can create undesirable torques, which can cause malpositioning. Surgeons need the ability to control, modulate, and monitor both the magnitude and the direction of force. Navigation and robotics have not given the surgeon this ability. Navigation platforms merely monitor the alignment of the implant, while robotic arms only assist surgeons in maintaining alignment. These platforms are essentially measuring the effect of the force that is applied. They do not attempt to control the application of force. If we instead try to control the application of force, we could begin to standardize surgical installation technique. A standardized installation technique would help eliminate aseptic loosening and malpositioning by eliminating unknown variables in the installation process. If surgeons knew the magnitude and the direction of the force that they applied, then they could understand how their actions contribute to malpositioning and poor fixation. The best way to standardize our installation technique is to select an alternate method of implant installation, one that requires the lowest level of force. The lower the level of force, the lower the risk of damage to the implant and surrounding bone. I've studied 3 alternative methods of implant installation: discrete impacts, constant insertion, and vibratory insertion. Vibratory insertion is by far the most efficient. Using this method, we can install an implant with 90% less force than used by the mallet. A vibratory insertion tool uses an oscillation engine to create desynchronized pulse waves which vibrate the implant. These pulse waves allow the implant to be pushed into place without impacts. A vibratory insertion tool requires far less force because vibration dramatically reduces the frictional forces between two surfaces. When frictional forces are reduced, surgeons can easily control the direction of the force that they apply, and therefore the alignment of the implant. We could reduce force even further if we superimpose ultrasonic energy on top of vibration. In other industries, ultrasonic energy has reduced the force required for press fitting by 90%. And since pulse waves are continuously disarming frictional forces, surgeons can continuously adjust the alignment of the implant. With the addition of IME technology, surgeons can also monitor in real time the exact inclination and anteversion of the implant.